and let you get that up there this week. Waska's here this week, so it's an exciting week. I do have just two brief announcements before we get started on introducing our speaker. I did send an email out yesterday. Congratulations, Dr. Future Doctor
Joey
Jang, for your publication. And on the line with us is Wendy.
Hi, Wendy.
We're all waiting, Wendy.
Hi.
Hi.
Thank you. Good morning.
Her publication out, and I have my copy for her. So we had two big announcements this week from our faculty and their scholarship. So we appreciate the efforts and everything. So congratulations to both of you. So now I would like to turn attention to today's meeting. It's my privilege to introduce Dr. Rosemary Goodyear. And Dr. Goodyear is one of the champions in nursing. She has a distinguished career. She's been a Fulbright scholar. I think her passport is out of pages, probably. You probably had a thick book.
I have it replaced.
You've had it replaced many times. She probably has more frequent flyer miles than I do. That's a lot. She does a lot of work in Asia, and she's been in Oman, influential with Oman. She's been influential just all around the world. Dr. Goodyear spoke to us at the Fellows meeting year before last when we were in Phoenix, and she talked about global nursing. And with our school's emphasis now on global health, I thought it'd be a great segment into where we could go. And we have the leader, a World Health Consultant. I mean, we have the mother of international nursing right here. So I'm going to turn it over to you. And bring the speaker up.
Okay. And my ineptness with technology, but I'll try. Okay, good morning. Can you hear me? Okay, I'll just sit down. Basically, I have some objectives, and the focus is going to be on the advanced practice nurse. It's not that the undergraduate nurse could not become and be involved in international nursing, but what my work has been was with the advanced practice nurse, the nurse practitioner, advanced practice nurse. And so that's why you'll see APN all the way through. And I've been working with the International Council of Nursing, and since 1997, actually, when we were meeting with different groups and trying to come together, how at that point in time could we really unify and develop a group, a network added to then with the International Council of Nurses. So we were meeting back in the 90s, and it didn't really happen until 2000. But I'll also identify health and non-health related organizations that you might want to seek out for information and research, and then distinguish the requisites for nurse leaders when working in the global nursing community, and then examine the process that you as an individual could take in order to become involved. The history and the overview of the International Nurse Practitioner Advanced Practice Network will be covered, and that was the organization that we started in the 90s, and then it actually formalized in the year 2000. And the International Health Organization and non-health related organizations, I'll give you a rundown on each one of those. That could be a resource for you if you are interested in moving in this direction. And what are the leadership requisites for work on the global nursing? We'll cover those. And then the process for preparing to be an international nurse, either in an assignment or through a project. Just to give you some eye rest, I've thrown in some photos so that you don't get tired with the slides. You can read the slides, I'll talk about them, okay? This is Fiji, coral in Fiji. You didn't need, was taken with one of those little cameras that you buy in the drugstore. That's how clear the water is in Fiji. The first meeting of the International Network was in 2000 in San Diego. And at that meeting, we had 25 nation states represented at that meeting and several US NP organizations. At that time, there were multiple in the 2000s. And at the end of the meeting, we had 54 email addresses around the world that we connected as the first members for this international network. And with 13 nations represented. So that first meeting, we had a nice sprinkling across the world. In the first organizational structure, we worked to develop that between 2000 and 2005. And I served as secretary at that time. Madrine Schoberg was our chair. And then between 2005 and 2010, I was chair. And this was the first international nurse practitioner, advanced practice nurse network in existence at that time. Since that time, Sigma Theta Tau has moved more internationally, but we were the first, and we were the network to ICN. And that network has the dual name, NP-APN. And why everybody says, why is your name so long? Well, it's very simple. When you're international, there are many languages that we interface with. Nurse practitioner does not translate in many languages, but advanced practice nurse does. So this is why, until this time anyway, the title is NP-APN Network. And from that, a definition was prepared by the policy group as well as the core steering group, which was what was set up to run or monitor that organization. And we then morphed into one core steering group and 6 subgroups, which still exist today. And you can go online at that network, which is ICN, and click on networks, and you can find out about the international network. The definition that was established and still exists today, it was okayed by the board of directors of ICN, and it still exists. It's in the process now of being considered, because the APN globally has also expanded, not only here in the United States through the consensus model, but also globally. And so advanced practice nursing has expanded, I would like to say, because we pushed and shoved into many instances to move it forward. But because of dealing with multiple nations at very different levels of advancement, the language, as your policymakers you understand, has to be very broad, and it has to be able to be applicable to all those people. So this is why it has stood for 16 years at this point, and seems to be challenged. It's being challenged, so we'll see what happens afterwards. Because when we were looking at this, we wanted to make sure that the nurse who was going to be a nurse practitioner, advanced practice nurse in the multiple lands, was in direct patient care. That was key to what we were setting the scope of practice and standards on. And so this does, at that point in time, did not really speak to nurse researchers, academicians, or anybody else as an APN, as we have accepted in the United States. So this is what they're grappling with at this point in time. How do we bring the other advanced practice nurses in other nations, and yet really the focus initially was on nurse practitioners, advanced practice nurses in direct patient care. If you go back and look at the standards that were published in, I think it was 6 or 8, they came out of this and speak to that direct patient care. Some of the nations that I'm going to be talking about, and the nation state is the global term that we use because some nations call themselves a nation, some call it states, so we just nation state. And they are the WHO regions. They come from represent states or nation states from the 5, 6 WHO regions: Africa, Americas, Eastern Mediterranean, Europe, South Asia, and Western Pacific. So I'll be talking about Botswana, Jamaica, Oman, Ireland, Thailand, and Fiji. Not the ones that you hear about a lot of times, because we often communicate with English-speaking nations in our literature and in our research. We don't think about these other smaller countries. Botswana is in the African region with the 47 nation states in Africa. And Botswana's program started 35 years ago. It was started due to the need to improve the health care of the citizens and reflection from 1978 Alma Ata Declaration by WHO. If you are really interested in going international, I suggest that you get that document, read it. This was WHO in 78, and read what they're talking about at that point in time and where we are today globally. And they also had a shortage of physicians, and the only physicians who were in Botswana at that time were missionaries or expatriates. And if you're going international, an expat, you all know what an expat is. Okay, they're global and they keep some of the infrastructure going in many nation states. But nursing was the largest workforce, and the Ministry of Health decided that it was going to upgrade their nurses in Botswana because they couldn't depend on how many physicians were coming to their nation. And so they sent 5 nurse midwives, and again, internationally, nurses and midwives are prepared together in many instances. Some nurses then get the foundational education if they follow the UK model, but some then may want to go into midwifery and some may want to stay in nursing, but their core is sometimes very much the same, if not the same. So many of their organizations and their legal foundations come from a nurse midwifery board. And so they sent these nurse midwives to the US to be teachers and to be role models for the other nurses to come in Botswana. And they created a good relationship with one institution in America, and that institution helped those nurses establish a curriculum for nurse practitioners. At that point in time, we were doing certificate level nurse practitioners, not moving essentially yet into the master's level. That came in '85 when ANA finally said we had to be master's prepared. Been there, done that. And the challenges facing them for the growth and development of NP came along, and they prepared their certificate level, and that's all they had because they had no university, okay, in Botswana. Just recently, the University of Botswana is established, and they now also started not only in nursing. Nursing started first, but now they have a medical school. So this has all evolved, and nursing has been a pusher in that nation. Now they have a master's program, and they are preparing master's level nurse practitioners. Their challenge is how to take that 470 diploma prepared certificate level NPs and allow them to move into the master's program without having to repeat a lot of the coursework. So that's their challenge. Come on. These are some of my colleagues. The lady in the short one with glasses, she was one of our persons on one of our committees early in the network. We were in a clinic in Molopololi, Botswana, and that clinic was basically out in the boonies. The patients walked to the clinic, and they have just come over the devastation of HIV/AIDS in that community. And there was one physician for I don't know how many clinics. All the rest were sister nurses. This nurse on the end in the uniform was one of the sisters that was working there. It was an eye-opener for me to go to that place and to see those nurses at that point in time. The next representing the Americas is Jamaica. Early in RNP history, Jamaica explored the role due to underserved and rural areas. Does that sound familiar? Not able to receive care, and there was a physician shortage. And the Ministry of Health investigated the role and initiated the certificate program in 1977. Oversight by the Ministry of Health and the Department of Medicine was implemented to make sure that the nurse practitioners were moving forward. And in 2002, this program was transferred to the Department of Advanced Nursing Education, which is now the University of the West Indies School of Nursing, and has elevated the NP education to a master's level. And there are still challenges in this nation. There's no title protection in this country, or they do not have prescriptive privileges yet. But they're working on it. It's a very small nation, but they're moving forward. these are some children from Jamaica that you might see while going to school. Looks familiar. Oman, from the Eastern Mediterranean region, is nation state with a health system of primary care centers throughout the nation in urban and rural communities. The Minister of Health has been interested and supportive of the NPAPN role, and the movement to progress is preparing to start a program in the nation state is underway. The movement is due to, one, a shortage of physicians, seems to be repeating myself, health problems due to lifestyles changes, people are living longer, and moving care closer to the patient was really important to them. And this is a very rural nation state, and so there's a lot of territory to cover. And there currently several nurses are receiving their DNP here in the United States. And currently, WHO consultants have facilitated planning using on-the-job training. So they're training some of the people who are already in the clinics throughout this nation to increase their skills and their knowledge. And so this is something that has moved forward. And again, a little bit slower in the Middle East, but this is a small village in Oman. Ireland, in the European WHO region, the nursing organization moved to make major changes through strategic planning and policies in the year 2000. The framework for nursing specialists was established. New divisions for developing these roles, rules, and regulations are in place and continuing to meet the challenges of these developments. Specific guidelines for each nurse to follow to meet the requirements were established and now are graduating advanced nurse practitioners with an MSN. And our current president of ICN, Annette Kennedy, is now president of ICN. So Ireland is well represented at ICN. There's the rocks of Cashel. One thing that I did get when I was able to travel to visit these nations was that I got to spend a couple extra days for my own and got to see a lot of these nations. So this is some of my photography. Okay, Thailand and Southeast Asia region is a long history of preparing certificate and graduate NPs. The Thailand Nurse Midwifery Council, along with committed faculty at Mayadol University in Bangkok and Chiang Mai in northern Thailand, have worked to meet the needs of preparing sufficient workforce. This nation also has a community clinic chain throughout the nation where they must be serviced by 3 people in the health professions or allied health professions. So one of the challenges that the government came to the health providers and said, we need 7,000 providers. Who can provide it? Well, medicine said we can, and nursing said we can. And so they stepped up to the plate and they began nurse certificate programs. And they have a history of having them previously because, again, because the country had to be covered by some type of a health personnel they were then linked to the regional hospital, but they were out there for the people to receive care. So they were supposed to prepare 7,000 nurse practitioners by 5 years. So they're working on that. But what they have come with is they now have a master's prepared program with 42 credit master's program, 2 years. And they have a short-term course of 18 credits for 4 months, which is counted if they come back and pursue the MSN. And what's happened is they cranked out all these certificates, and my colleague Somchut called me and she said, Rosemary, she said, these nurses all want to come back to school. And I said, I told you, you can't put these nurse practitioners out there without any backup, without any linkage. They need more education. She said, I don't know what I'm going to do. So they started the master's program and really ramped it up and are getting these people back in and getting them prepared at the master's level. She retired though. There's one of the temples in Bangkok, Thailand. Fiji, Western Pacific, that's where the coral came from. 1998, the first basic NP program was developed with WHO assistance, and one of our fellows was with HO and went to develop it. And right now I can't bring up her name, but anyway. So in 2010, the Fiji School of Nursing merged with the Fiji School of Medicine to form the College of Medicine, Nursing, and Health Sciences within Fiji National University. A remote program was initiated by the director to the Marshall Islands, with faculty traveling to those islands by plane to teach these students. The Fiji Nursing Council now requires annual registration of all NPs and evidence of annual engagement in continuing professional development. These NPs travel by water to visit the patients and hold clinics. And it's a mirage of little bitty islands, and so they're basically in canoes or boats of some type to get to their patients. So they only have certificate there, but they're starting their master's program. So this is where they're at. And this is Philomena, and she's the person who has moved the nurse practitioners forward in Fiji. Okay, like that. I want to go back previous. Now I'm really lost. Okay, this one's the one I want. There we go. Okay, the international organizations: United Nations, World Health Organization, International Council of Nurses, Sigma Theta Tau, Fulbright Association, and the Global Alliance for Nursing and Midwifery. Those are all the websites. And if you're really interested, what you're going to do is you're going to take those websites down and you're going to go search them for information on how to become internationally involved. United Nations brief history, established in 1945 by FDR Roosevelt, and it has many branches and task forces and programs to work under the umbrella of the UN. Perhaps one program we know best is UNICEF for the children, but membership and representation is extremely important to many nation states outside of the US. You can read about the membership guidelines and thus gain an understanding that the importance for emerging nation states is to belong to the UN. Membership brings status, assistance, and access to many international links that are not available without being a member. And I will have to also say that the EU has done that in Europe as well. The World Health Organization, oh, that's a street and island, and the houses are just as beautiful as that. And one time I noticed the same thing when I was in Russia, and I said to somebody, I said, why are the houses painted in pastel colors? And they said, well, the winters are very long and dreary here, and the only thing we have that brightens us is the color of our homes. And I thought, all right, okay. So the international, I'm just going to tell you a little bit about this. I'm skipping around here somehow. The World Health Organization was started in 1948. My technology, you can ask Rick, is horrible. So the purpose of the World Health Organization was to take care of the people's health throughout the world. And this is where the Alma Ata Declaration came from, and where you might want to go back. And like I said, it has 5 or 6 regions, and that's what I've used. The International Council of Nursing is a federation of more 130 nations, national nursing associations. And it was started in 1899. But some of its formative meetings, and the U.S. really doesn't pay attention to ICN. Have you noticed that in your nursing relationships in the organizations? We don't really look to ICN for much, do we? And yet, the formative meetings were held at the World's Fair in Chicago in 1893. And some of our American nurse leaders were the reason that ICN was founded. But I guess we think we're better than everybody else. I don't know. We don't need them. But the rest of the world does look to ICN and does need their help. And so their purpose is, again, to establish policy, sound health policies, advance nursing knowledge, and is present in the worldwide community of nursing and very respected. And it works with other international organizations in Geneva and is the National Nurses Association. That's how you become a member of ICM, and that probably is why many of us don't know, because as individuals, you're not a member. You're a member through ANA. And every other nation is a member through their National Nurses Association. But the NPAPN network is how you can become an individual member, and it's free. So if you want to be an individual member of ICN, join our network. And then, or there's networks for researchers, there's networks for regulatory people. So there are other networks, and that's the way you can actually become an individual member of ICN. Sigma Theta Tau, we all know it works in the International Honor Society and reflects this in its title. The website information provides you information on programs, opportunities to become involved, also about grants and scholarships that are available through ICN to work internationally. This is the Health Institute in Botswana. When I was there in 2006 to teach a class, this was our orientation and entertainment, if you will. These were hospital workers from Botswana, and they were singing in their native language and telling the story of how they have lost so many of their fellow workers to HIV/AIDS. And I didn't understand a word, but I had goosebumps listening to them because the empathy came through their voices in their story, even though I didn't understand what they were saying. You didn't have to. You heard it through those people. And then, have you heard the mostly African people ululate? There was somebody in the audience that stood up and started to ululate, and that really set off the whole audience, and others then who also can carry out this singing, chanting of ululating. It was awesome, and something I'll never ever forget. In my technology failure, I had my cell phone, and if I would have known how to record it, I could have recorded it. Now you know why I retired. I couldn't keep up with technology. The Fulbright program probably is one of the, for me, the most important international organizations that totally is ignored by nursing up until recently. And I don't understand why. To be a Fulbrighter is to take your research, present it, submit your life's history and all the rest of the things, and consider going to a foreign land for a year or half a year under a grant that somebody is written to and they want to have help, or you have a connection with. It's probably the most respected I have ever been when I traveled, is as a Fulbrighter. And it's under the State Department. And at this point in time, I don't know what's going on with it. I know we're still functioning. We still have a Fulbright Association. And Congress knows who we are. It was started by Senator Fulbright back in 1948, 46. And it has, well, some of the figures, there's about 1,600 US students to study internationally through it. 4,000 foreign students come to the United States to study. 1,200 US scholars go abroad, and 900 visiting scholars come to the US. So this is what happens every year. And it is a wonderful program for nursing. There's not a nursing category. So you have to look under medicine or you look under global and public health. And that's my area, would be global and public health that I serve under. And as a specialist, you can become specialist without becoming a scholar. Previously, you had to be a scholar before you were eligible to become a specialist. But now you can go through the Fulbright Specialist World Learning Organization now to apply to be a specialist. And that's what we would call a short-term, 6 to 8 week program internationally. But you have Fulbright supporting you and the host nation jointly supporting you. So it's something I think that we need to tell nurses about when you're talking to your graduate nurses and they're interested in going abroad, working abroad. They need to know about the Fulbright Association. It's a must. The Global Alliance for Nursing and Midwifery is a website to find out what's going on internationally. You can just join it, just go to the website and you can sign up and you get it. You can get it automatically every day, or once a week or once a month, however often you want to read it. But all the things that are going on around the world, this is started by Johns Hopkins and monitored and supported by Johns Hopkins, and is a good place to find out what's going on in the country maybe that you want to go to. This is a lady in Thailand weaving silk. So Hopkins put out this definition of what a global nurse is, and take a minute and read it because it comes from their program and comes from the Global Alliance, and I think we can all agree on the definition of what a global nurse is. This is a Bedouin grouping. They're still active in the deserts. So you want to go. Let's talk about what you need to do and where you have to start. The first thing, Bosch is a textbook on international health that you might want to explore. I have a list of references at the end that you'll be able to find. Excuse me. And he points out 5 things, maybe give you a start anyway. Are you interested in training and experience within different populations? Are you interested in humanitarianism? Are you interested in response to disaster? Do you have an intellectual curiosity? Or do you want to escape from a vexing life situation? He doesn't suggest the last one. But it is a book to start with, give you an overall picture, and it's something that you might think about now as we go through the rest of this. The methods for preparing: self-analysis, state of affairs in your life, read and website searches, create and teach a class on global nursing, those of you who are in academia, and seek out a colleague and a mentor. Some of you have traveled and have gone internationally. So once you consider, do a SWOT on yourself. Do you know what SWOT is, don't you? Okay, look at your strengths, look at your areas of weakness, look at your opportunities and your challenges, and put it on paper, not just mentally, but actually sit down and write them out. What are your areas that you have to work on, and what areas do you really shine in already? Here's the workshop that I was teaching in Botswana. These are some of the participants. We were trying to prepare nurses out in the field to be preceptors. And many of them had gone through their certificate program, but now with increasing the numbers of certificate nurses, they needed preceptors. So they brought back their first nurses who were nurse practitioners and then we taught them how to evaluate the students and how to grade them. And so this was a workshop that we did back in 2006. Okay, investigate the nation, states, environment, and governmental political rules, economics, and cultural realities as they exist today. How do you gather that info? Where will you go to gather that area? I gave you the organizations so you can start looking at that. Explore the nursing profession, rules and regulations. These are things that, regardless of where you're going and what your job is, this should be foundational information that you will need. You can't go in there and say, oh, just do things as I do here, because that's not acceptable. When I was a Fulbrighter in Malta, I was not allowed to touch a patient because I did not have a license through the UK, through Malta or through the UK. I was not recognized. And so I was able finally to carry out my research through one of the pediatricians who I worked with, who allowed me to go through his charts after they were recording, after they were doing their day's work, I could go through and pull out some data from his charts. He let me, couldn't touch a patient, but I was able to read the charts. So that's the beginning of your language. Gain a knowledge of the cultural issues regarding gender, role of women in society, and their educational options. There's a reference on here that you need to read, and I refer to it in a minute. Tornquist, Tornquist, WHO, they did a research study on the regions of WHO in the state of nursing in all of these regions. And it was done in '97, but it's essential for you to read, because out of that it came the common themes that they found, regardless of the population groups, regardless of where they were located in the world, these themes that came out. Nursing is predominantly women. Women do not have access to education, and it's male-dominated, physician-dominated. So those are three things, regardless of where in the world they took the data. These were the things. So one thing that is extremely important is, what is the role of women in nursing in the world before you go in there? Are they respected? When I went to Mexico in 2005, they did not see the role of the nurse to be educated at the graduate level, the clinical nurse. That role was just one step from being the mom for all the children. Very, very paternalistic society. The woman's place was at the home. They had not made that transition. Nursing was educating administrators and nurse educators at the master's level, but the clinical nurse was not being educated. So they could not understand why the NP, the APN, was needed to serve the patients. This is basically is Mexico to the end of Argentina. It's the role is not there yet. And so in many nations that you're thinking about going to, it is extremely important when the major workforce throughout the world are females. I'm sorry guys, but that's important for you to know. Not in the Middle East. In the Middle East, women take care of women, men take care of men. So there are parts of the world that it's not as important. But in many instances, women are not allowed to go to school. In Africa, they can go to school if they have the money to buy the uniform. But if they don't have the money to buy the uniform, there's no way they can go to school. So look at that culture and look at their educational options. Study the nation state's health program. You need to understand where they are within providing health care for their citizens. One of my little hill people out of Thailand. Moving forward and becoming involved, connect with the government, with the organizations of assignment, and clarify your requirements. If you have already connected with somebody, what are the requirements for your project? Once you identified it, do your research on that nation. You need to understand all the things we just talked about and refine the purpose for your scope of work. Make sure you understand what you're going to be doing now. Access and follow the guidelines that the organization gives you, because you will have to follow guidelines. We had to make sure that we understood that we were under the embassy when I was a Fulbrighter, so I had to be able to understand what the pros and cons, and at that time we didn't have an ambassador because of ill feelings between us. And so you need to understand all of that, because it's there, but they're not going to come out and tell you. So you need to do your homework before you go to those settings. And now we're going to wrap ourselves. To wrap yourself, you need to start with wisdom. Wisdom, you will be taking in some of the information that will be helpful when you prepare to access the assignment, accept the assignment, textbooks, WHO, ICN, and resources that we've talked about. And respect, we'll talk about the audience you're going to be working with and the patients. That's something that we all need. So Oh, my zebras. And that, I just covered your wisdom. You need to increase your wisdom in relation to the international community. Respect is so easy to say, but often to internalize in practice. Yet, this is integral for each nurse, and especially when working in another's domain, such as in the international community. I return to one of my revered mentors, Virginia Henderson, and share some of her words that may bring focus when thinking about respect. A capacity for feeling kinship and have a listening ear. Develop self-awareness, and self-knowledge and self-respect are fundamental to the understandings of and respect for others. Audience, who are you going to be working with? A group, a community, a colleague, professional, during your assignment or your project. Learn to be quiet and listen, and listen, and listen. Then, when you have a good understanding of the issue that they're discussing, then you can contribute suggestions of resolution. You can incorporate your colleagues into the problem solving within the context of their situation and their resources and the professional climate. All of those things really have to be considered. Patience. It's a virtue I was passed over at birth, but I'm learning. But even I have learned to accept a different pace at which things move forward. And when they are not as you wish them to be, you need to look at their style of living, letting the host lead, being aware of non-English speaking and using translators, and spotty or no Wi-Fi, sorry, in these places. And after you work with a translator and you think that's easy, no, the first thing you learn is when you're presenting, you can only cover 50% of the content that you wanted to cover, because you have to stop after each sentence and let that sentence be translated, unless they are sufficiently wealthy and they have simultaneous translation, which I've had one once in all my travels. So be prepared. Don't really realize either how tiring it is to stop, translate. And so it does. This is the nation state of Jamaica, just to give you an idea of that nation. Okay, some common sense kinds of things. Research the U.S. government guidelines and restrictions. Consider clothing, housing facilities, and transportation. Are you going to a hot and humid climate? You're going to a cold or freezing climate. What is the community going to be like? Are you going to be taking transportation, or are you going to be chauffeured? Consider language and the translation needs. Consider the food, the culture of eating and fasting. Learning the neighborhood where you're going to be living, and connect with nursing professionals. Make sure your passport is up to date. Must be 6 months from your time that you leave. Require health measures, immunizations. How are you on your yellow fever in some of these? International health and life insurance coverage. So these are things that sometimes your agencies that you're going with will provide coverage, but all of this needs to be explored. Exiting your host nation. Create a plan to mentor your colleagues in following your departure. In many instances, you're going to be held up on a pedestal because you have brought them so much in knowledge, so much in your experience. They just idolize a teacher in many nations. And you being a teacher, my role has been as a teacher. And they really do want to hold on to every word that you say. Sometimes it's very difficult to leave. But create a plan before, when you go there, start building your exit, because they're not going to want to let you go. And so you have to begin to work with them for that. Facilitate and outline and strategies for moving forward for them without you. Identify how to stay connected and to collaborate. This was my second group in Taiwan. the person, there are some faculty, 1, 2, 3, 4, the lady in pink in the back row, she was the Deputy Director General of the Health Department where I started teaching nurses how to teach. She's now Director General of Nursing and Healthcare in the country of Taiwan. So talk about moving up. The lady in the yellow next to me, God love her, Curly, she was a very outspoken caregiver who wanted to learn how to teach other caregivers. She's now finishing her master's in gerontology. The young man on the front line here, he was a caregiver who worked with Curly. He's now getting his BSN. You can't imagine how proud I feel of these people, that you have given them the opportunity to learn and then instilled in them the ability to want to go back to continue their education. That's my reward. So in reflection, disseminate your experience through sharing with colleagues in home, agency, institution, publications. Get your colleagues together so that like this, and you can tell them what you did. Learn from your experience, stay connected, and be a mentor to a peer. My philosophy when I was in graduate school, and Dr. Loretta Ford was my chair, said we had to have a philosophy of nursing, and we had to have a philosophy that's going to support us. That's one of the hardest things sometimes I know when I was teaching nurse practitioners, and that was one of their assignments, to write their philosophy of nursing, and they all came back, that's the hardest thing to do. This has been my philosophy, and it has stood me well through the years, and I'll share it with you. Go to the people, live among them, learn from them, love them, serve them, plan with them, start with what they know, and build on what they have. Thank you. And there's your references. I think there's 2 pages. Yeah, so I'm not going to try to go back.
We've got our slides on our machine.
Any questions? Any answers?
I have a question about a specific thing that you put on one of your slides. I don't remember which country it was, but you said that the nurses didn't have their titles protected.
Yeah, in Jamaica. And that basically is a law that in our state we have definition that says this is a nurse, and in order to qualify this you must meet these regulations. Same thing as a nurse practitioner. Each state in the United States, you have to meet certain criteria, and it's a law. And in those countries it's not a law, so their title cannot, anybody could say I'm a nurse practitioner. So by a protected title, that's what we mean, is that there's statutory law that gives the rules and regs of what it takes to hold that title. And that sometimes is, the nations that have the hardest time are the oldest ones who are more rigid. And I think you can even look at the United States. The nurse practitioner didn't start in the eastern border of the United States. It started in the western border in Colorado, because the ideas are younger and not as steeped for as many years. And so change tends to take place in the newer nation states or newer parts of the nation, and then gradually gravitates to the old, more rigid, structured states in the United States. And the same thing in Europe. Those countries, I have a colleague in Germany who, their laws in nursing change from county to county. And so if you live in one county, you can do this, but you can't in the other county. In Germany, it just drives them crazy. And so when the EU came in, you can imagine what's happened with the EU. Now the nurses in France are trying to get their laws changed to allow them to practice nursing without a direct written order from a physician. This is 2018, and they're still doing, I mean, so you have to go back globally, as we did in the United States. Things happen faster and more frequently in the West, and then gradually go. Same thing with Europe. The countries are very staid, where some of the newer nations who don't have all the laws and the regs as Europeans do, where the laws are more flexible in Asia and in these nations, they are more freely accepting the role. And where they don't have the picture of the woman being in the home and having children, and where the role has been able to evolve. It's moving forward more. So.
Another question.
And we're hearing aids, so speak up, please.
Okay. Has there been any discussion among ICN or the governing bodies of nursing in the countries that you've traveled? Has there been any discussion related to doctoral degrees or preparations as a requirement for advanced practice, like we're having here in the States?
Yes, and that's why the definition states that master's is the preferred degree. But you also then have to look at what and how they prepare their generalist nurse. The term that's used internationally instead of ADN and BSN is generalist nurse. The generalist nurse is prepared differently in every nation. Some may use the same model, but what happens is because of their culture, their resources, what have you, they modify it. And so that's why we put down in the definition of an NP, APN, that the master's is the preferred level. Most of the nations that I have visited, like I visited Finland in, I think it was 2006, they were pinning their first certificate nurse practitioners in Finland. And that country has a national health insurance, so there was a direct pathway. And Elizabeth, who was the program director, she had the head of their health system there at their first graduation, and it was almost an automatic entryway for the nurse practitioners in Finland because they had universal health care, and the NP would be one of the first gatekeepers and then to direct the patient. And I said to Elizabeth, I said, how did you get her to come give the talk? And she said, she's been on it since the beginning of the program. Well, that was 2006. They're now at the master's level. So they immediately saw that in order for that role to become effective, that it needed to be at the master's level. They didn't wait for the students like Thailand to come back and say, we need more education. They already had that vision. So most of the nations globally are moved towards that master's as soon as they can because they see our history, they see the history of other nations around them. So they are, yes, it's talked about. We just had a teleconference with, I guess, 6 or 8 nurses from France, and there are about 6 or 8 of us from the US with the AMP fellows, and they wanted to know how to move forward and what they had to do. And we said, basically stay on the path that you're going. You're working with the government to get some of these rules changed, and you have to persist. You're going to have bad days and good days. We said network so that you have a support system. And we all said the same thing, just keep going. There's always challenges. Even though we could go in and say, no, don't do it this way because we messed up back in the US. They have to see their challenges, where they are at, and if we don't understand the politics of what's going on, our advice or what we did may not apply. So you really have to go in and find out what's going on before you can really give them direction to move the role forward to a master's degree. That's why I'm working with the people in Taiwan to transition where they all have about, I think, 12,000 certificate prepared nurse practitioners in Taiwan, very few masters prepared. And now they're wanting to move, and they're all hospital based. They were really educated to take the burden of the role of the physician in the hospital, not to serve as we serve as nurses, as a link between physician, medicine, and nursing. And now they're having to get them to want to move into the community because they've started a long-term care program. They need some 2,000, 3,000 nurse practitioners in the community. So I'm working with them now to develop a transition curriculum for the nurse in the hospital to move into the community. And I told the community nurses, I said, now you're going to have to up your salaries. I said, if you want these people to come to you, you're going to have to give them incentive. And then I told the educators, I said, you're going to have to make this a master's level course. When they come, you're going to have to do sorting out. They've already have some of the basics. Now give them the graduate level and expand their scope of family and community and get them with a master's degree. And I told the people, lady in pink, I said, you have to fund it. So we'll see. That you've got a big job ahead of them, but it does get discussed. Thank you for the question.
Thank you. So Ruth has joined us. Ruth is from Manchester.
Yeah, well, yes, I'm from England. I went to Manchester University many years ago to do my bachelor in nursing.
Okay.
And worked in England until 1998, and then I moved
Good.
here.
Was I correct?
Were you correct about what?
Talking about the international nursing?
Yeah, I mean, it's 20 years since I've been in England now, so since I've worked in England.
Well, they've got a national health
I think
system.
Well, yeah, obviously. That
Their
was-
title isn't protecting. Talk about Jamaica. The title isn't protected in the UK. Have not been able to get the UK to come through on a title protection. So, yeah, it happens at different paces. And where the structure is strong, it's going to take longer. It's a bigger challenge. So the poor French nurses are just getting out from underneath the physician to practice nursing. So they're going to have another challenge. It's again that this is safe, this is old, it's worked, we're not ready to change.
It was like 1912 or so when we got the title protected. Early 1900s is when the U.S. protected the title.
Oh, yeah.
And started with the first license.
1906 in North Carolina, I believe, was the first one.
One of the first licensure exams had
Right.
10 questions on it.
Mhm. Yeah. And that's why we probably moved forward more than Europe, is because we were the new guys on the block. We saw that what we needed. Yeah. We don't like change. We like status quo. It's comfortable. But nurse practitioners, when we became a network in ICN, the to-be executive director was our staff person. We worked with a staff person to take all our business to the CEO and the board. And he was from Scotland. And he was a reg person. He now is executive director of the National Council of State Boards, David Benton. Anyway, he didn't know he thought he knew what nurse practitioners was, because Scotland had some language already in their laws to accept the advanced practice nurse. But then when he saw how ambitious we were as a group, and that we were going to do this and we wanted that and all of this, and he said, why are you doing this? I said, you don't understand nurse practitioners. I said, nurse practitioners are pushy. We're not aggressive, we're pushy, and we're assertive. And I said, we have moved through the United States and got 50 states to recognize what a nurse practitioner was. And I said, it's time ICN recognizes who we are. And he couldn't quite grasp who we were. So we educated him about the nurse practitioner. And I have to tease him every time I see him. I said, now you understand advanced practice nursing, don't you? He learned the hard way through us. And he eventually became executive director of ICN. And then a couple of years ago, he moved over here. So, but it's hard for that organization to understand what nurse practitioners were. And we turned out to be the biggest network, over, I don't know, almost 2,000 members, 30 countries, 30 or 40 countries represented membership. And we also bring money to ICN. So they don't have too much to say negatively about the Advanced Practice Nurse Network. So, but we've educated them.
On your initial work in building capacity or starting, in your early work of of building a curriculum for advanced practice nurses in different colleges and countries that you've been to? Did you work initially with faculty and work mostly on training them so they can then turn in training the students? Or do you have a group of your team to come and do the initial teaching with the hope that your initial graduates will then start teaching that curriculum to sustain the program?
No, basically work with the people in their institution, and depending upon the preparation of the individuals. And in some instances, they would bring in physicians because the nurses did not understand how to do health assessment. And in some instances, there are physicians who would like to see this role move forward. And that link, collaborative link, sometimes is essential. There's only one time that I brought my colleagues in to teach. And that was because we had to do it within 8-week summer session. And there was no way to prepare to get their people up to speed. And so my colleagues from my consultancy came in with me, and we rotated through, and I had 4 faculty who came in to teach. And but that was because of the time frame, and if you've got time, from my perspective, it's best to teach the faculty or allow the faculty to come back to the U.S. to be prepared at certain things, as opposed to bringing people in with you. Unless you can mentor teach. When I was in Malta, the people were trying to start a bachelor's of nursing, first bachelor's of nursing program. And there's one university in Malta, and everybody goes to the University of Malta. And so, even the bus drivers. But they wanted bringing me in to teach, and they thought I was a psychiatric nurse, and I said, no, pediatrics, not psychiatric. And so I wanted to see where the hospital, and when I went to the hospital, it was back in the 1930s for standards of what I would expect in America. It just wasn't there. And they were still counting linen. And I met a nurse on the PD unit, and she was a Maltese. And I went back to the expat who was the dean, and I said, why isn't so-and-so over here teaching pediatrics? Well, she's not a teacher. And I asked for her vita. She was a fellow, had been a fellow to the United States, had gotten her master's at Tulane and went to Berkeley as well. And I said, I think maybe we ought to bring her in, And so anyway, what I did was I mentored her. I taught the class, but for a full year, two semesters, she was right next to me. Learned how to teach, learned the content, and learned how to present, etc. That worked probably the best. When I went back to Malta when ICN met there in, 2010 or whatever, I met my students. There had been sophomore students, and they came, we got a reunion, got it together. One of them was now head of the School of Nursing. One of them was head of the Public Health Department. It was really neat. Some of them had 8 kids, good Catholic place. I mean, it was just really neat to see them and how they had grown and matured. It was really nice. And so she was still teaching at the school. So that, if you can do that, if you have a long enough time period to be there for that long, I did as a Fulbrighter. I was there for the year. So I had that time to be able to mentor her. So when that's possible, that's the best, because they had no nurses prepared at the master's level. Any Maltese, they all were general nurses or midwives. And so there was nobody there at the level to teach pediatrics in a bachelor's program. So there's more ways than one to do it. And you just have to really listen and see what resources they have and what you can do with those resources. So you have to, that's nurses, we can always adapt, can't we? As a nurse, you always, use newspaper when you can't find this, or we can adapt. It's the same thing with people and resources.
So we're coming to the close. I want to thank you on behalf of the college for coming. I'm going to run to my office. I've got a couple gifts for you I need to bring you.
Good luck on your WASC. They wanted to know when I came in if I was with WASC, and I said, no, but I can be if you want. Been there, done that many times. Thanks for having me.
I have a question about, a little bit about your background. So when you were doing the Teach the Teacher, I really love that approach. By the way, I think that's very collegial versus colonial.
Yeah.
I really like that.
I'm working on finally trying to get the research out. I hopefully will get it out this next 6 months. But we did some little basic stuff and teaching traditionally, and it was Phoenix, the person who was at the health department, who said, I want you to use Train the Trainer because it's going to be a very intense program. It was in 2 weeks, we taught the nurses. I taught nurses how to develop curriculum, establish modules, write objectives, teach, and evaluate in 2 weeks. And these were nurses who were working in geriatric settings. I had interprofessionals. I had the caregivers. I had PT people from the nursing community, and the agencies were sending their people who they thought would be good teachers of their caregivers. So it was interprofessional from beginning. And it worked really well. And they worked their little fannies off. And if you've worked with nurses in China or in Taiwan, they're very, very quiet. They don't say anything because they were taught, as we were taught in first grade, to whatever, listen to the teacher. She's the knowledgeable one. He's the knowledgeable one. And so the first day I said, you're not going to be sponges. And they looked at me and said, you're not just going to sit there, take up everything. I said, this is participatory education. You're adults. We're going to use adult learning principles. They never heard of adult learning principles. We started off with, I gave them somebody they didn't know across the room, get together, and I gave them an assignment to interview one another. And then I said, then switch after 5 minutes, and then you're going to have to get up and report. They said, in English? I said, no, you can report, because I had a translator literally tied to me. I said, don't worry about it, use your own language. And then I used different little gimmicks and games throughout. And I used adult learning principles to teach them. By the end of the 2 weeks, I couldn't get a word in edgewise. And one of the things they said that the best things that they learned was there was different ways to teach. That you didn't have to sit there and constantly take notes, but that you could interact. And some of the pictures, they're all over the room. I mean, there was no order to anything. And by the time they finished, they were all like singing and what have you at the end of the classes.
But my question is, so when you did that process, were you part of a college or a university? And secondly, did you give this curriculum freely, or did you charge for it, or how did that go?
I was not, it was with the health department. It was not a college or an institution. And it was set up as a program in the health department. The person who wrote the proposal to Fulbright and got it funded and got me, it was really ironic because I had worked with her in 2005 and 2007, 2008. I didn't know it was she who wrote the proposal, because when they ask you if you're interested, you don't see the proposal or who's presenting it. It's blind.
So this was through Fulbright?
This was for, yes. And this was in 2014. And so when I found out who it was, I put him, I said, Phoenix, is this you? She said, Rosemary, is this you? And we realized that we had worked together. And at that time, I was working with them to establish their policy for nurse practitioners back in 2005. And the terminology so that it was broad enough. And so that's how I had met her, worked with her at that point in time. But it was her idea to, use Train the Trainer, and then it was her idea to have it within the health department, because she found money to find it. She can find money anywhere. Found money to fund this program And then the people they came for 2 weeks constant from 9 to 5 or whatever we did. And then they had to go back and work in their jobs. None of them were given sabbatical to go to school. So they then had to go back and do their job after they finished the class. But we did peer review on their teaching. They presented to the class only a little 10-minute section of what they wanted to teach. And it really turned out really well. Pay? No, they paid my business fare to get there. That was the pay that I received.
Yeah, I'm familiar with the Fulbright program, so that's great.
Yeah, so even though I've got a consultant business, I went because of the Fulbright first, and Fulbright paid me. They gave me a stipend for so much a day. But since I've been going back 15 and 16, now it paid my airfare. So that was enough to get them going. So, yeah.
Okay. Well, I know you need a coffee cup.
Oh, I need a coffee cup.
But you need a water bottle from our doctoral program.
Oh, neat. Thank
Because
you
you
so
can't be
much.
happy.
Thank you all. Great.
Yeah. Well, thank you so much for coming.
Thank you for inviting me, Rob. I didn't do too bad on technology, did I?
No. Even some of us have trouble with our technology.
Yeah, but they don't need it.
Thank you so much. Oh, you're welcome. Do you have a card? So you going down? Are you going down to the one and beautiful meeting advanced practitioner?
I don't know. I'm gonna work with them on the curriculum.
Okay.
Now, when I go back, I don't know, not this year. Since Hogan's being excused, not this year.
It's a good thing. Yeah. So I don't know what she will. Those things to do. So.
Which is great. Well, yeah, if they can, well, as long as they're going to be getting the community. Well, in the Philippines, they've got a connection already. Nurses already going through native schools.
Wonderful. Well, so great to meet you.
Good luck to you.
Thank you.
So it was really interesting because I'm listening to you talking. I just like grandchildren because I do a lot of work with our hospital partners as because you're a hospital, so they do a lot of right, right? I oversee the health system. And so I'm already thinking about everything you're saying about us. Those nurses come to work here, we make assumptions. We make assumptions, and I'm just like, because my background's financial consultant, you know, the preceptors I've been working with, you know, we kind of do a brief overview on how we want them to